The coronavirus here in the U.S. New cases of the virus plunging to their lowest level now in nearly a year, from 250,000 cases to less than 25,000 a day. Tonight, the numbers here, more than 163 million people 12 and older receiving at least one shot of the vaccine. That's more than 58% of people in this country. And the CDC revealing it is investigating tonight a small number of reports of a potential heart problem, potential inflammation in more than a dozen teenagers and young people. Of course, that's out of millions of shots administered. But the CDC is warning doctors and healthcare providers and parents to be on the lookout for any potential symptoms. Dr. Jha standing by on that tonight. And this evening, the images from over the weekend showing 15,000 basketball fans packing Madison Square Garden, New York's biggest indoor gathering since the start of the pandemic. This was great to see. New York City schools, the largest public school district in America, will fully reopen in the fall. They announced that today. We do have it all covered on the virus, including those new questions about the origins of the virus itself. Calls for an independent investigation tonight amid reports that U.S. intelligence showed 3 workers at that Wuhan lab went to the hospital with flu-like symptoms a month before the first case was made public. And so ABC's Steve Osunsami tonight from the CDC in Atlanta.
This tonight is what the end of the pandemic is starting to look like. For the first time, more than 15,000 fans at a basketball game in Madison Square Garden, the largest indoor event in New York State since the pandemic. People who could prove they were vaccinated didn't need to wear masks.
New York, we're here!
From the NBA playoffs to the links at the PGA Championship, from graduations to parades, the vaccines are helping to get life in America back to normal.
It's been a whole year we haven't been able to come out and celebrate.
The average number of new COVID cases that were as high as 250,000 a day in January is now below 25,000 new cases a day, a 90% difference. New York State says it will fully reopen public schools in the fall.
1 million kids will be back in their classroom in September, all in person, no remote.
But the CDC tonight says it is investigating reports that a very small number of young people who've been vaccinated have developed a condition called myocarditis, an inflammation of the heart. The symptoms were usually mild, went away on their own, and were seen in more than a dozen teens or young adults, usually men, about 4 days after getting their second dose of the Moderna or Pfizer vaccine.
There's nothing to raise concern. From my perspective, the risk of COVID is so much greater than any theoretical risk from the vaccine.
Doctors are on the lookout tonight for fatigue or shortness of breath, but they point out that these are still only a tiny fraction of the more than 130 million people in this country who've been fully vaccinated without any issues.
They're trying to investigate to see if they're related at all to the vaccine. At this point, there is no relationship proven.
As the world recovers, there are growing calls for a deeper investigation into how the coronavirus got its start. The Wall Street Journal is reporting new details about 3 workers from the Wuhan Institute of Virology who had to be treated for COVID-like symptoms in November of 2019, about 3 weeks before health officials believe the outbreak in China began. It's not clear if the 3 workers actually came down with the disease. Investigators from the World Health Organization have said it's extremely unlikely that the virus spread after a leak from a lab, but they also say that the Chinese government didn't give their investigators full access to information.
I think that we should continue to investigate what went on in China until we find out, to the best of our ability, exactly what happened. I'm perfectly in favor of any investigation that looks into the origin of the virus.
These questions are not going away. In the meantime, Steve with us from the CDC tonight. And Steve, in a push to boost vaccinations here in the U.S., we've reported here on several states following Ohio's lead in rolling out lotteries for residents who get the vaccines. We know that 2.75 million people signed up in Ohio. Tonight, word that they've held their first drawing. And Steve, they're going to make the announcement Wednesday to give them enough time to double check now with state health officials on the vaccination record.
That's right, David. They need to first make sure, of course, that the winners actually got the vaccine. In Ohio, they're giving away $1 million at every drawing, along with a full ride scholarship, room and board included, to a state university to vaccinated teenagers. The state reports that this is why vaccinations are up 94% among 16 and 17-year-olds. David?
A really interesting experiment. Steve Osunsami with us tonight. Steve, thank you. We know many parents likely have questions about what you heard in Steve's report there, that heart problem found in a small number of cases, more than a dozen teenagers and young people, but that's out of tens of millions of shots administered. But let's bring in Dr. Ashish Jha, Dean at the Brown University School of Public Health. Dr. Jha, always great to have you. And first, the CDC made this public, so obviously they think it's important enough to be aware of it, to be on the lookout. But help us put this into perspective tonight, the small number of cases, and what should parents and young people be looking for here?
Yeah, so David, thank you for having me back. Look, anytime anybody raises concerns, we should take it seriously. These are very small number of cases, and there's no definitive link yet that it is actually caused by the vaccine. And thank goodness that the people who do have this tend to recover pretty much fully. They have very mild symptoms. So we should be on the lookout, but we should not get overly concerned.
All right, we appreciate that. In the meantime, we follow every new headline on the effectiveness of our vaccines, and we know that the variant discovered in India, we know that it's highly contagious, but there's a new study out tonight that shows the vaccines appear to be effective at preventing it, at least so far.
Yeah, these vaccines continue to be just really effective against all the variants. And we do see with the Indian variant a little bit of a loss in efficacy down from the mid-90s, maybe to the mid-80s. But boy, still so good at protecting people against severe illness from even these variants.
Yeah, mid-80s. That was what we were hoping for before we even had the vaccines. Dr. Jha with us again tonight. Thank you, Doc.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.